Good afternoon. I'm Laura Takanka. I'm a public health major with public health major with a pre-med focus, and I'm a freshman.
Hi, I'm Christina. I'm a first-year nursing major, minoring in entrepreneurship and public health.
Hi, I'm Benedicta. I'm a chemistry major and a minor in public health, aspiring for medical school.
Okay. So our product we're trying to put on the market is called CareHub. So the problem that we're trying to solve is that we realize that opioid use and opioid addiction is a burden on the United States and even lower as a city. And it's get worse when mothers or pregnant women have opioid use, and they are worried about how their children, the babies, are gonna come out due to the increased rate of neonatal abstinence syndrome, which is conditions that make a child, a newborn baby, act as someone that is being withdrawn from drug use. But Mom Do Care, which is a program in Lower General that helps moms who are pregnant during antenatal care to make sure that the kids are, the babies are not infected by the drug use. They said the problem that they face the most is that parents do want to come and check for their babies, but access to transportation to get to the hospital is a problem. So the problem is access to transportation. That's what we're trying to look at as a team.
So for statistical data that's more on the general basis of people who are facing opioids, between 2005 and 2014 there was around a 62% increase in hospitalizations for people facing opioids. And in 2011 there was around 488,000 people that had emergency-based visits for opioids. Within 2015 to 2016 there was around a 27% increase in the death count for people that suffered from opioid abuse. And there was around 42,000 people in 2016 that suffered from opioid abuse and eventually died, unfortunately. And then for more data that's based on our focus of CareHub, which is more for women and children, every 15 minutes there's a baby born with neonatal abstinence syndrome. And within 2014, it's the ratio around 6.5 babies for 1,000 births from mothers that suffered from the abuse and pass it on to their children. So in Calvert Health Medical Center in Maryland, they're doing a more focus based on a mobile app that they use for transportation. And in Denver Health Medical Center, they partner up with Lyft and use it to create their own app for transportation. In Taylor Regional Hospital in Kentucky, they have a more focus on their own personal van service for transportation. And in Grace Cottage, they have a focus on their own volunteer-based van service. And like these, we do also have a focus on helping with transportation to hospitals, but our focus is more on opioids and specifically mothers, and theirs is more like a general focus.
Okay. So our proposal is to create an app that allows these women to just call in for transportation from our services. So we have the app that they can request, if you use an Uber, you request for the ride to come. But in this sense, we're not partnering with Uber, but we're planning on maybe partnering with UMass or True Volunteer, that UMass will have a work study where they will volunteer one of their vans to give women ride to their appointments so they don't miss. And the idea of the solution is to provide confidentiality, so that way whoever is volunteering to drive the people there don't know why they are going there, so the person is saved and they are rest assured. How the app works, so to make sure that people don't abuse the app, we'll make sure that we get the names of people who actually need a ride. The transportation is their barrier from Mom Do Care or any hospital that is running such programs, so that they will have a code to access the app, so not just anyone will be able to access the app.
Continue on what she said about the solution. We would also be reducing the stigma that is posed upon them in the society or the community. Mostly people involved with opioid and other drug abuse do not want to go out or do not want to talk to others because they have this pressure or tension on them to not talking to others or going to the grocery store or even going to the hospital themselves. So we can reduce the stigma in the community on them, and also it will be more accessible, and then it will be more like a private thing. You go on your phone, you click on where you want to go, and then it will just be right on your door. It could also be for nonprofit, where it will basically be set up based on funding that we get from the school or from the volunteers according to the work study and everything that we put in.
30 seconds.
So with funding, we could help basically to collaborate with individuals who service within the app and create our own personal mobile app. The funding will be more focused to help us get started in running the app and help also with advertising to help broadcast it to the people in Lowell to help them know that there is a solution for them if they are suffering through opioids, and any volunteers that would like to help along the way. An important way to explain to individuals what our focus is, they need to create a more website, which is another source of advertising for us. And we estimated that our budget is going to be around $25,000, and that is more focused on the creation of the app and helping create transportation, so whether or not we need to use a bus or a car and things like that.
And lastly, we also plan on using the money over time to like train volunteers to make sure that like when you're having a program that has to do with human contact, you want to make sure that they have like the right way of talking to them or interacting with them. So we want to also make sure that we always have our apps updated and the events updated. Yeah.
Time.
Thank you.
All right, no worries. Thank you very much. Open to questions.
So, did your leader not show up?
He's a testing right now, anatomy.
So, if you didn't tell us your leader didn't show up, I wouldn't have noticed it.
Mm-hmm.
So you did a very good job. And this is the sort of poop that happens to you in real life and business. Poop gets thrown on you, and you just have to like wipe it off and move forward. And you did a great job. So you should feel nothing was negative. So you should feel very good about telling your leader, hey, next time you got to catch up with us.
Yeah.
So you did a very good job, seriously.
Yeah, we didn't even notice that it was the same day, because like I also have a time slot where I can choose my room for next year. It's the same day, same time, so I have to do it like later in the day. I also have my calculus class, and it's also the same student employment week, employees week right now happening at UCrossing, which I was supposed to be there, but it's just a lot of things.
So
that
thank
happen
you.
at the same time.
So can I ask a question? So about the presentation? Is there a way to use an existing app like Uber or Lyft, whether they use like a coupon code or a certain user code, and very much respecting the goal for confidentiality, but you save a lot of money, right? And most people can get that on their phone pretty quickly. It is hard to get people to load up a new app on their phone.
So that was the ultimate plan, to partner with Uber, but we also realized that that might, like the time that would take for us to partner with Uber, we can like start something up while we wait for them to be like, okay, we are agreed to do it. Because I know, as we mentioned, some of the other hospitals are already doing that with Lyft, and I haven't seen anyone that's doing it with Uber. So our initial plan was that we'll partner with Uber, and people can like, when you call for Uber, like it can ask you for like, do you want to donate like this amount of money to like this project. So our ultimate goal is to be able to have a collaboration with Uber sooner or later.
Yeah, it might be difficult to get in contact with such like a big company, but if we do start off with advertising and just creating a website and making more like traffic towards like our solution, I think it would be easier for us to get in contact with them like later on.
Okay, thank you.
Yeah, and also it's because opioid addiction it's increasing in lower community, especially with heroin and other drugs, and it's like on the website. Like when we go online, we'll find all of these, and if we attach the link or any donation or advertisement attached to a newspaper or document or reading portfolios online, people could see the other people are in need, especially the mothers who are going to give birth, thinking about what might happen to the children at the end of the labor.
Thank you.
Do you have any estimates for the numbers? I mean, you gave the sort of macro numbers of how many, but this is going to focus in Lowell. Do you have a sense of how many people you might be, what's the full number? Because that will help you think through the number of students who might be driving. I mean, that's going to be part of your solution. Do you have a sense of that?
We don't have like a specific number of women, because we got this idea from like Difference Maker. One of their programs that they host, the Mom Do Care came, but they didn't really give like specific number of like women that are in their program. But they said the majority of the women in the program don't come to appointment because they don't have like access to transportation. Yeah.
And if we do like start off with Mom Secure, it'll be easier to get like a patient list and like more specific people who like we could help as well.
Are you familiar with healthcare Uber?
No.
Uber healthcare?
It was our first time in projects in Europe, and it helps us learn more about a lot of things about the healthcare and opioid regulations. Example, the neonatal abstinence syndrome. I didn't know anything specifically how the children react after they give birth, and how they cry a lot because they need a lot of food and they need more attention. It helps us to learn more about mothers and what they go through whenever they want to stop their drug use and want to focus more on their children and make their children the best people they want them to go.
Right. Might be worth your while to look into healthcare Uber. Yeah, it's different from Uber, but a lot of hospitals are using it. And you give the person's name and you correlate it when the driver shows up, and it's a lot cheaper than taxis. And
yeah, you presented a request for $25,000 to fund this going forward. Could you detail out exactly how much money you need for app development or website development? Have you broken down those little details?
I think when we researched, the app development was about $10,000 or more. And for like we're also thinking about if we have an app and want to get like a van for people to volunteer to drive, like that will also cost a large sum of money. So like also creating a website and also managing it to make sure that we can advertise, it's also like a large sum of money. But that is not to say that if we don't get $25,000, we're not willing to go ahead and have like a backup plan for this to work, because it's something that is like important to us.
Okay.
And also, even if we don't get the money, we can partner with Lowell General Hospital and the Moms Do Care. When we partner with them, it's a public organization, and they might get some funds for us at the moment, for which we cannot just get a huge sum of money to just get off the jump. We can just start as little by little, and then we can grow. And then also, when we manage to set this app, if we manage to instate this app, we can also like spread it to, for example, Worcester and other places where they are also in need of help on opioid basis.
You may be able to get an estimate from, you had asked how many people this could impact, but if you know that there are 6 babies born every day at Lowell General, so 2,000 a year, and you say 6.5%, so then it's 130 kids a year, so that could give you a sense of the scope of what you need here to say like, oh, we do need a van, or we don't need a van, or we could use Uber Health. So there may be some information out there that you can get together. It doesn't have to be exact, but if it's kind of close, it'll give you a sense of what you need.
And even if we help a couple of people, what we do for them can lead them to talk about it and tell their friends. And some people have links and connections. Maybe I'm a victim, but I have no idea how to get help. But if I get help, I could talk to maybe my aunt, someone who has money, and then the person could donate, and then it would improve the system of getting quality health care among peers or in the community.
Yeah, like it's definitely something that could happen like gradually. Like if we start locally, there could be more awareness and more people spreading the word about it, and we could broadcast it to more of like parts of Massachusetts, like she said, like Worcester as well, which is also something.
Any more questions? Okay, in
I
which
just want
case,
to echo what Glenn said, you did an excellent job.
Yeah.
Thank you.
Yeah,
Very
good job,
clear.
guys.
Actually, I'm nervous.
yeah.
Good job.
All right. Well, that's time. Thank you very much.
Thank
Thank you
you.
for adapting.
Thank you.
Thank you,
Have a
judges,
nice
for
day.
5 minutes.